think if you move slightly, that.
It's just
Look, isn't this fun?
Okay, that's better.
Look, it's like the Brady Bunch. We can all like. There, I need. You're in the middle. There we go.
What you see behind me are structures that are 10 foot by 10 foot that each are prepared for one patient. And back in late March, the governor of Maryland, Governor Hogan, determined that it was headed our way, and the state itself did not have the capacity.
I don't think I've ever been part of a team that really came together so quickly and was so focused and really jumped in together to address that need.
It was a little bit like speed dating. We got to know each other incredibly quickly and really got to know each other's strengths.
Walked into a convention center and sort of had to figure out, okay, where do supplies go? How do we get food here? How do we get transport? And had to pull in a lot of local businesses. Most of those services are contracted, so it's working with 10 or 12 different vendors with different skill sets, different experiences, and it's been challenging, but it's been a privilege.
This has been a collaboration since the beginning between Hopkins and Maryland, between the state and the city, and the team includes medical planners and physicians and nurses, and then kind of a whole slew of non-clinical folks, food services and EBS and supply chain and transport and kind of facilities and security services that we need to operate this site. And just as, our clinical providers are taking care of the patients, the support services teams are taking care of all of us.
So Dr. Cancifer and I were responsible for hiring a lot of physicians, and we were worried about that in a COVID-positive environment, how successful we'd be. And we've just had an enormous outpouring of support. Physicians, nurse practitioners, and physician assistants have really come to work in the field hospital in droves because they feel that the mission is so important and that the teamwork has really come together in a way that they haven't seen in many, if not any other places.
Here we have a pharmacy staff that is outstanding. We have social workers that are giving these patients a really, really safe discharge plan, making sure housing is squared away. So I think in the history of field hospitals, we try to provide outstanding care. One of our employees who had never worked with patients before, the other day was seen reading to one of our patients who was very visually impaired. And this individual had just taken it upon themselves to sit in their cubicle with this patient to read to them because they thought it was the right thing to do. And that's with no background in healthcare. So that's the sort of thing that needs to be celebrated.
Somebody drew a picture in chalk on the concrete outside of a provider with a cape on. I think about the name of this series is Right Hero, Right Now. And I think what this team has been able to achieve, and the people on the floor, the staff included, has been really incredible.
If you think in context, we have 1,200 employees hired for this effort, and they stood up. They knew that there was risk taking care of coronavirus infection patients, and they still did it. And my partner, Chuck Callahan, Chuck is also the Vice President for Population Health at University of Maryland System, and is the co-director of the hospital. Very much an intrinsic part of our team and a leader of our team.
Behind these masks that we have to wear, there are just courageous people who answered the call, who stepped up, and they show up every day energized, full of compassion, excited to be here, and just ready to take care of these patients. And so it's really special to be a part of the team and have the opportunity to lead.